All right, here we go. Good evening. It's definitely evening this time. It's 8 p.m. I'm actually on East Coast, I guess. Yeah, that's where I am. So, what is that? Oh, so I'm. This is Sunday Night Live. Sawadi Cup. I'm really happy to be here. Kind of tired and spaced out because of this conference today, but it's a great conference, the Beljanski conference in Florida. Met some amazing people today. You guys are like amazing. I'm just so honored that so many people came to hear me. That was great. That was fantastic. Um, but next time, Nathan Crane, the guy who put it on, said he'll give me more than 27 minutes. So that's good. Anyway, so yeah, here I am in this hotel room. So anyway, by the way, I'm leaving tomorrow real early. Yes, Simone. Yeah, everybody is so fantastic. I met you all. A lot of nice to put some names and faces together. So yeah, I leave tomorrow morning real early, like 5 or 6. I got to get up. No, 4. I got to get up. So tonight I'm going to try to make this a little bit shorter, like maybe just 1 hour. But anyway, I'm so glad you're all here. That's cool. Let's hear we getting people here. Which is which? Yeah. Okay. Let's get on with it. Let's start looking at our questions. Now, how do I I'm so bad at this. How do I do this? I guess I have to go like that. You can still see me, I hope. And then where's the questions? Here's the questions. Okay, cool. No, that's not him. Where's the questions? Questions. Here we go. Good. Okay. All right, cool. So anyway, Sunday Night Live. We're Monday morning for Asia, Monday morning for Australia, New Zealand, all that. Okay, so you guys are ahead of us. Any way to get spike protein out of your system? There are, of course, nattokinase does that, and there are actually quite a few protocols. I think Dr. Peter McCulloch has a really good protocol. I think. And the problem is that there's conflicting information. Is the spike protein something that there's so much misinformation that it's really hard to keep track. First of all, the spike protein and the mRNA we're hearing about, right? And we know that they're causing problems. We think that. So we think the mRNA instructs the cell to make. Hello, everyone. Spike protein. So you're making trillions of spike protein a day, and those are what's causing blood clots and myocarditis and things like that, cerebral problems. And then there's another group that's looking at all these the original injection material, and they're looking at it and under microscope, and they're saying there's no mRNA, there's no spike, and it's just synthetic bacteria and our synthetic biology, and hello there, and that the only thing that stops them, rather than any kind of medicine, would be putting them in a Faraday cage, because they've tested it. And a Faraday cage is something that blocks electromagnetic frequency transmissions. So I'm like completely confused what's really in there, because I myself haven't looked in the microscopes and I haven't looked at this thing. So I'm going on what I hear. But, I see a lot of published studies on dealing with spike protein. So, and yet I hear from credible sources that it's not in there. So, wow, I don't know. But I would say Dr. Peter McCulloch has got some good protocols. There's another one, the chlorine dioxide, sounds like it's excellent. But and we know nattokinase does. So there was a study came out in Japan, and it was replicated by other groups. So we know that works for the spike protein. But there's a lot of people doing a lot of research on that. And since I'm not personally involved with it, I don't know what's real and what's not. So I apologize for that. Let's go over some questions here. Yeah, there's a question from Lincoln, and who we're talking about. Okay, so thank you very much for treatment plan for bladder cancer. Remember what you guys we don't like that word, right? Because it's a painful word when we hear the word CANCER. Remember, that's just a sign that goes between Gemini and between Leo. And, it's one of those creatures that live on the shore near the sea, and they like to crawl around sideways and stuff. That's what that is. That's not what's going on in any of our bodies. We have chronically fermenting cells, and we have acutely fermenting cells, and we have chronically fermenting cells. It's just part of biology, okay? Sometimes it gets out of hand, and we have to figure out why that's happening and eliminate the reason why it's happening, okay? That's what we got to do. So anyway, this lady is saying, or Lincoln is saying, thank you very much for the plan for my bladder CFCs. After working your plan for 4 months, urine test results negative for high-grade urothelial carcinoma. Thank you, Lincoln and Jean. How will taking 2.2 milliliters of fenbendazole 2 times a day affect a normal and healthy liver? And would it be a good idea to take 250 milligrams of milk thistle daily for every other day as a precautionary measure? Yes, anybody. Taking milk thistle is a great idea as precautionary. And remember, in addition to the milk thistle, you can take milk thistle or its derivative, which is silymarin. You can get that directly, and you can get that usually in any health food store or online, I'm sure, silymarin. And then there's a derivative of silymarin called silybinum, but you can be taking those, and that's a good idea. Thank you for bringing that up, because but how long a person can do it? For a long time. Look at Joe Tippins. It's 2017. He's been doing it ever since then. Now remember, your enzymes go up if you're taking several of them for a while, and then they'll go down. But do multiple 3 weeks on, 1 week off, 3 weeks on, 1 week off. Do multiple of those, and then go into a maintenance schedule. Yeah. Oh. Okay, so anyway, let's go on. Okay, next one is I got that one twice. Okay, this is Kanshi. Her name is Kanshi, I guess. It was yeah. I was diagnosed with triple negative breast CFCs, stage 3C, that involved 2 lymph nodes above clavicle and 3 on my right, axilla, and a 10 millimeter tumor in my right breast. 4 weeks of Taxol, Pembroke combination. I then completed 4 treatments of adriamycin. My follow-up MRI ultrasound showed no evidence of tumor in breast, only the marker, and all lymph nodes were back to normal size. Following this was the lumpectomy and lymph node dissection. 37 were removed and all negative. I feel like I'm being bullied into radiation. Question: In this instance, is radiation necessary? No. My my God. Let me just wait. Let me understand this. Wait a minute. You, after all that therapy, the follow-up MRI and ultrasound showed no evidence of tumor in breast. So what was the lumpectomy? You had a lumpectomy on something that when there was no lump. It doesn't. That's not okay. It's like they had a plan, and regardless of whether or not they're successful or not, they did that. They went in, did a lumpectomy on what? There was no lump. So I'm very confused about that. And taking out 37 lymph nodes were removed, and they were all negative. And you feel like you're being bullied into radiation? Who's bullying you? Just run, get away from there. That's crazy. Radiation for what? Anyway, let me just tell you what happened. When you get those maximum tolerated doses of chemotherapy, what the consequence is that it's going to shrink the primary, and it's going to ensure that you get metastasis. So therefore, that's why right now it's very, very essential that you do detoxification. We've got. I don't know if you've had cone beams with a good biologically biodentist, and make sure you didn't have cavitation, make sure you didn't have root canals. You got to get all those out. You've got to get any metal removed. You've got to have someone who really knows what they're doing. You got to do that, right? You've also must do parasite cleanses, and you must do juice cleansing, colon cleansing, lymphatic work, all the things that we always talk about, right? Remember, when we get CFCs, it's really an opportunity for us to, it takes away our excuses, right? It's an opportunity for us to now start living a life that satisfies all of our biological, psychological, and spiritual needs, so that our body doesn't need to go through any adaptive processes, such as we call high blood pressure, CFCs, heart attack, stroke. Those are all attempts at adapting. Diabetes is an attempt at adapting. What we call CFCs is an attempt at adapting. So let's make it so that our body doesn't need to adapt. And that's one of the beautiful things about having CFCs, is that we have that opportunity to do that. So this is what you need to do. So, Kenshi, I don't know where you are or any of that, but I feel very, very sad that they're doing this to you. It sounds like you didn't need a lumpectomy since there was no lump, and it sounds like taking out 37 lymph nodes. It's just crazy, and I don't want to make you feel bad, but don't do any more. Don't do anything else. What we need to do now is get rid of any parasites and start taking things that are going to eliminate CFC stem cells, such as ivermectin, curcumin, vitamin C, doxycycline, and doxycycline is going to be a good idea too, so that none of those CFCs from the breast go to the bone. Okay, but there's a lot of those things. So, Kanchi, if you could get in touch with me, we could, work on trying to help you. Yeah. So anyway, you don't need radiation. Okay, I promise you don't need radiation. Not only you don't need it, you don't want it. It's not, because it's not good. It's going to only increase the likelihood that you have problems later on. That's what it's going to do. Okay. Okay, so here's Andrea, and last year I was told that I had papillary lesion and atypical ductal hyperplasia after a mammogram and biopsy. I have refused surgery. My problem is that multiple doctors have said that the ultrasounds and thermograms are inaccurate, and I am scared to get another mammogram. How am I supposed to monitor my progress? I have dramatically changed my lifestyle and done multiple alternative treatments for the last year and a half, but I don't know how to proceed. I appreciate your help. Okay, so first of all, for them to say your ultrasounds are inaccurate is crazy, because when they do a mammogram and it's equivocal or not quite sure, they do an ultrasound to confirm it, because it's actually quite accurate. So whatever, I'm not sure why they said that. They don't use thermograms because it's not in their. They don't even know the technology. They don't even understand it. So they just say no because they don't do it. And they think, you got to remember what most of these doctors think, right? You know what they think? They think, listen, I'm really smart. I got into medical school and I got out of medical school and I'm really smart. And so if I don't know that, it doesn't matter. It's not worth knowing. And therefore it can't be true. You think I'm kidding, right? You think that's a joke? No, that's the way they think. If you call it thinking, but that's what they do. All right. So that's mind-boggling. So now, how are you supposed to monitor your progress? You're going to monitor. First of all, you've got to be doing some other things too. Your progress. You said you're doing alternative therapies. Now, what I've learned is a lot of people think they're doing alternative therapies, but when I talk to them, I find out that they're not doing them in proper dosages or proper frequencies, even if it's vitamin C, intravenous curcumin, or whatever it is. You need to maximize the amount you need to do. You need to understand, how much do I need to do? What's the optimal to achieve the goal I'm trying to achieve, and how frequently? So vitamin C, you've got to be drinking it orally so that you're satisfying your biological, your physiological requirements for vitamin C. Then when you get your IVs, a minimum of twice a week, maybe 3 times a week, the IV will not fill up a deficit. It will go to becoming therapeutic. You want a therapeutic level of vitamin C to be about 350 to 400 milligrams per deciliter in the plasma. Okay, that's what you need. All right. So, if you're not drinking it every day, you're going to have a deficit. So when you get that IV, you're going to find that 50 grams is not enough, 75 grams is not enough, 100 grams is not enough, right? Because you're trying to fill up the deficit first. So that's that. There are many other things, to do. Interventions. There's quercetin, there's curcumin, there's ozone. Ozone's very important. So I don't know what you're doing, and I don't know, just because they say it's alternative therapies, a lot of times it's not enough. And I don't want you to be misled. I don't want you to have, not be getting enough. So I guess I wonder if I can post something, not post something, but put something on the website about what I consider, like a good program, right? And sometimes people do insulin potentiated low dose chemotherapy. That's also great under certain circumstances. So Andrea, I wish I had a chance to talk to you to understand what you're doing. But anyway, whoever's telling you that ultrasounds and thermograms are inaccurate, I don't care. They're wrong. They're wrong. The combination of ultrasounds and thermograms, far better than a mammogram. Okay, and the mammogram is a dangerous thing to do, right? Very dangerous, So if I can help you in any way, please get in touch with me or send me another question. I know it's hard to get in touch with me lately. I'm going to be, when I get back to Thailand, then it'll be easier. Yeah. Okay, so here another one. This is actually obviously a breast cancer. Breast CFC. I'm sorry. So anyway, I'm 49. This is Maura. I'm 39, and I have stage 3 invasive ductal carcinoma, ER positive, PR positive, HER2 negative, grade 2, with 5.8 centimeter tumor. Went to the lymph nodes and armpit, one above collarbone. I want to opt out of chemosurgery, radiation, and hormone blockers. How can I heal this naturally? Good question. Beautiful. I'm glad you want to do that. So, Well, first of all, I know you were just listening a moment ago, and you understand you've got to get. Listen, here's the thing. Think about it. Our body is going through an adaptive process. Why? Because something is either causing it, like there's a toxin that's in our jaws. You know, the jaw the you know, we either have cavitations or root canals. We've got some other source. We've got infections inside. You know, something like that is going on that's fueling this situation. And also we're all toxic. Remember, do you remember being like a young kid, 6 years old, 8 years old, 9 years old? Well, you know, I don't know nowadays the way children eat, but when I was young, I remember, bowel movements were never a problem. You know, you did it a few times a day, and it was large, and you're always clean, and and then as you got older, things change, right? They change. They change. Why? They change because we start to accumulate toxins as we get older. So we don't realize that our kidneys aren't working as good. In fact, what we learn in medical school is that uh, every decade of life, you lose 10% of the function of your nephrons, or the little functional units of the kidney. Wow. So that means by 100, you have zero function of your kidney. Well, that's not true, because we see the Hunzas at 120, 130 with functioning kidneys. So that's just simply not true. But that's what they teach. But anyway, they're right to some degree, and that is, if you're living a poisonous life like we do, then you're going to have loss of function because of accumulated toxins. So all of our organs of elimination will start to get slowed down, right? And that's what happens. So they get slowed down. We start to accumulate waste. In addition to that, now that we're adults and we're not playing anymore, because when we were kids, we loved to play outside and run and do all that. And now we're not. We're sitting around doing work on computers or whatever we're doing. So we're not as active. So we're not contracting our muscles to push to clean out our lymph and to clean out our blood vessels. And so we're starting to really, really stagnate and collect toxins. And that's what happens. Then when those toxins are collected, are accumulate to a point of affecting our, pituitary gland, our testes, or our ovaries, thyroid, and all that, then our hormones start to decline, and then we actually see the effects of what we call aging. But aging is just accumulated toxicity. Now, of course, we're going to all eventually age, yes, but we've got a head start on it, right? If you're living the lifestyle that we live, we've got a head start, and that head start is we're like 30, 40 years ahead, quicker than people who are living natural lives. Okay, so anyway, that's how this all happens. So accumulated toxins, and it can manifest in this person as a heart problem, this person as a brain problem, and this person as a kidney problem, this person as a CFC, right? Just remember that it's all one condition, and it's called toxemia. There's a great book, if you want to, I recommend you read it. It's written by Dr. John Tilden, MD. It was published in 1915. That's right, 1915. And he was an MD, and he was. It's called Toxemia Explained. Get the original version. Don't get the new Americanized version, because it's written in English that only I don't know. Anyway, it's not written it's written in a really poor American. It's not written in English, but it's written absurdly. But get the original version, and it's beautiful. But he'll explain everything. I love it. Right. I have metal fillings and some root canals. Do I get all of my teeth pulled? Not all your teeth, but your root canals out. Biological dentist. You've got to find a biological dentist. Okay. You've got to find a good biological dentist. You look on the website of the biological dentist that claims to be a biological dentist. Look under services. And if they do root canals at all, if they do that, they're not biological dentists. Okay. Also, if they put a lot of crowns on, they're not really good biological dentists. A good biological dentist would do the inlays or the outlays and not put the crowns on, because crowns are an opportunity for problems, right? And they've got to be able to do cone beam CTs, 3D CTs. Make sure they're able to do that. All right. Okay. But you got to do that. You can't. Yeah, you've got to do that. Okay. Now, so this person, you got to get rid of this person, this Mora that's asking me the question. Yeah, you're right, Mora. So you're ER positive. So you got to eat lots of soy, flax seeds, make flaxseed smoothies, 2 tablespoons, um, ground up, in nut milk, and then you can put in, spinach or whatever you want, or some kale. Put in blueberries. You don't have to put in spinach and kale. The whole idea is to get those flax seeds. Put 3 tablespoons. Blueberries or strawberries, and you have a nut milk. Make it delicious. Okay. Um, Soy, miso soup, tempeh, natto, um, tofu. Yeah. So, because those are all gonna bind to the estrogen receptor beta, which is going to shrink things down. Also, if you can find a doctor who can prescribe to a compounding pharmacy to get 2-methoxyestradiol, which is also called 2-ME2, because that's very, very good. Look that up on PubMed. And remember, you don't ever believe doctors, because doctors don't tell. If you have a soy allergy, then you don't use it. Okay, so don't use it, but you can use the flaxseed. And you got to find out if you really have a soy allergy, or if it was the type of soy you had. Like sometimes there's soy cheeses and stuff like that. It's best to eat the soy in a pretty as pure as possible, like edamame, miso soup. Do those give you a problem? So you need to find that out. Okay, so now, and this woman Mara, you got that. So I have a feeling, Mara, that there's something that's keeping you toxic, and you've got to figure that out. And then you're going to have to do colon hydrotherapy at least 2 a week, for at least for 8 weeks. Lymphatic, try to find a lymphatic therapist. Then you got to do a major cleanse. Do a juice. Just make yourself a celery, cucumber, spinach, kale, lemon, and green apple, and make it or red apple, whatever you need to do to make it delicious. If you don't want the apple, you can use carrots, whatever. Give it a little bit of sweetness, a little bit of all those other, a little bit of sour, and a little bit of the greens. Get the greens. Okay, so remember, celery and cucumber give you the volume of water, of fluid. Okay, because there's not a lot of water in spinach. There's not a lot of water in kale. Then you're going to use the kale and the spinach for all the phytonutrients and amino acids and chelated minerals, all that sort of thing. Then you're going to use the lemon to take away any bitterness that might have been in the green, and then you're going to take the apples to take away any sourness, and you're going to make it sweet enough that you love it, but not any sweeter than that. All right, very, very important. And excuse me 1 second. Okay, sorry. Okay. Now, okay, so I'm going to skip over here. We have somebody asking questions with prostate CFCs. This is Michael, and I think about doctors the same way you do from the mainstream. Never vaccinated my children, so we are on the same page in many ways. I'm looking at clinics now since I was diagnosed 3 months ago. Okay, we got it, Michael. Let's we got to first of all, we have to do an exorcism on you and get that diagnosis out of you. Remember with these guys, when they do their diagnosis, it is they cast a spell on you. So that, let's. I'm only using hormonal therapy right now, and I'm going to the radiologist tomorrow to see what he thinks. Well, it has metastasized and went into the smooth, few small area, little bit in the lymph glands, bones, little spot on the liver. Huh. So, but where's the primary? Anyway, prostate. Yeah. Okay. My question is, I'm looking for a clinic, and I'm very impressed with your clinic. However, I wanted your opinion about all these clinics in Tijuana, Mexico. I'm scheduled to see Dr. Yu in a month of January. I am scheduled to go to biological dentist this upcoming week. Do you think this is a good time to do that, or to wait until I get my, don't use the word, until you see Dr. Yu? I'm interested in going to your clinic or somewhere else. Okay, so here's the thing. Age 65, no other health issues. Am on a proper diet now, living in, okay, now, first of all, proper diet, I'm not sure what you mean by that, but a proper diet is human diet, and a human diet is plants. And we were having this discussion today. I was having it with someone, and that's another whole discussion. I'm not going to go into why I know this, but we're plants. A really easy way, if you want to find out what humans should eat. What I'd like you to do, just do this so you can figure it out yourself. You don't have to read a book or ask it. Take all those off and go. Oh, don't take it. Drive to, or have someone drop you off at a forest or a jungle, and then drive away. Then you take all your clothes off and you go in the jungle and you move there and live there. Okay, and so you'll see, here you are in the jungle naked. What are you going to eat? What are you going to eat? What are you going to try to find to eat? Okay, so think about that. Think about what do you have? What did God equip you with to eat? Well, these hands to me look like they're I don't know, plucking, picking, planting, things like that. That's killing. It's kind of hard, especially. I mean, I guess cows don't really run away, so you could jump on a cow and just start. What would you do with the cow? Let's say you jumped on top of it, and would you take a bite out of it? Probably not. What would you do? Get like a big branch and then just start beating the cow, and then what? Then open it up. You see what I'm saying? Or it's too big. Okay, so let's grab a frog, choke the frog, and then I'm gonna eat it like that. So I'll tell you what I might do. I might probably going to find some berries and some fruit and some plants that I knew were healthy. See, we don't even know how to live on the earth. We don't know what's edible and what's not. Isn't that crazy? But anyway, so when you say proper, you can't be proper right now. You've got to eat 100% human food, okay? Because you are a human, and right now your body needs all the help it can get, okay? Because your body was designed to heal and to protect, keep your spirit inside for a while, okay? Now, so that is, and you got to be doing cleanses, colonics, juicing, things like that. You got to do all the things that we've been talking about. Your biological dentist has got to be a real biological dentist, okay? Dr. Yu is great, but you can't wait. I would get started on a parasite cleanse if you can, okay? Because you need to be doing that. I think what do I think about mistletoe therapy by injection? It's great. There's a couple ways you can do it. One is subcutaneous. You do them, usually do them 3 times a week, and you someone who would advise you on which one to use to start with. You can also get it IV, and it will help. It's very good for it's an immunotherapy. And if you've got it in your bones, you're going to need things like doxycycline. Hi, Rachel. Okay, yeah. Excuse me. Somebody just said they met me today, and they want to know if they get access to my slides. I gave a short presentation on parasites, but what I'm going to do, everyone, is I'm going to do as soon as I get back. we're going to do a webinar. We'll do it on Zoom, and I think like 200 people can sign up, whatever it is, and we'll do the full-on parasite um, um, PowerPoint that I have. All right, and then it'll be available for you guys. But we'll go through everything. So yes, that's what we'll do, and that will be announced on one of our social medias. And remember, we're on Instagram, and we're on TikTok, we're on YouTube, we're on Rumble TV, we're on LinkedIn, we're on our website. We're live, drlodi.com/live. Yeah, Facebook is pretending that they're trying to help us. You know, but you know what? Facebook just doesn't care. Yeah, Facebook says it can. Okay, you don't, you guys, as you guys talking about the horse paste, you don't need the horse paste. If you go, there are websites where you can get the fenbendazole pills, 222 milligrams, 3 times a day. Ivermectin, 12 milligrams, 3 times a day. Niclosamide, 500 milligrams, 3 times a day. Mebendazole, 100 milligrams, 3 times a day, or 500 milligrams, 3 times a day. Praziquantel, 600 milligrams, 3 times a day. And then tinidazole, 100 milligrams, 2 to 3 times a day. And you pretty much got most of it covered. And if you think it's a protozoa instead of a worm, then you might want to add Alinea 3 times a day. So my view on the clinics in Tijuana, Mexico, at one point in time, they were all we had. They're the only choice. Now, what's happened is I talk to people who go down there, and they are they're no longer less expensive. They're like almost equally as expensive or more in some cases. And it really depends on the doctors involved. Now, there are some down there that say, come to us for 3 weeks for $40,000. That's a lot of money for 3 weeks. And you're going to change my life in 3 weeks? The answer is no. I don't care who you are, who they are. They're not. Okay. So it's a lifelong journey. You got to change courses in life. You're no longer going to walk down the road you were walking on. You're going to make a right-hand turn here. And part of your new life is going to include going to bed early, all the things that we talk about, changing your life so that you're living in a way that you're satisfying your biological requirements. And then you'll be fine, right? Now, the therapies you get have to be done correctly. Now, what's happened in Tijuana is that, well, there's a Dr. Donato Perez Garcia, the third. He's very good down there. But I think he's and the other ones I'm not so sure about, because I have different kinds of opinions. But fortunately now, you can get the same kind of care that we used to think you could get in Tijuana. We can get in the U.S., especially Arizona, because Arizona allows a little more medical freedom. So Arizona and Nevada, but Arizona specifically. And so we're doing, like, for example, we're doing everything that they do there, and more. So you've got to take care of all things. Now, remember, if you're going to be on a CFC program, what you want to do is make sure that they've got 3 aspects. They're going to help you change your internal biochemistry through fasting, cleansing, and all that, and meditating, prayer, meditation, okay, all of that. And then you're going to once you've finished your fasting and cleansing, you're going to start eating really healthy food. Yeah, no, I know we're more comprehensive. Somebody was just mentioning here that Robert Morris has just been banned from his YouTube. I'm sure I'll get banned sometime. I'll tell you that. Yeah, somebody went to Tijuana recently. Yeah, so they've just changed over the years. I mean, I remember way back. It was the Tijuana was, like the only place you could go, and not a lot of people knew much about it. But now it's changed, and they're expensive, and it's crazy. Anyway, so that I agree with you. Yeah, that's very good. I'm glad someone is talking about that. Okay. Um, I'll answer your question in a minute. Sweet violet pear. Um, so anyway, now Dr. U is great, but get started on your parasitic cleanse. You'll do fine. You'll get. You're 65. You're healthy. Otherwise, we just have to figure out what's fueling this and pull it out. Right? Okay. All right. Now, my CFCs have erupted out calcifications. How do I catch calcifications if I'm not doing mammogram? Okay, calcification just means that calcium has been gone into the tissues as a last ditch effort to alkalinize it. Number one. Number two, it could also mean that you've got these little calcium forming nanobacteria that get in there too. Yeah, and that could easily be it. But you don't have to worry about that. You don't think about calcifications versus something else. It's all manifestations of the same process. You're just going to take care of your problem by all the. You don't have trying to find it is not going to help you. Just get rid of it, eliminate it through diet, sleeping right, all the things we talk about. You got to find a good clinic. Okay, this is from Lena. The women in my family on my mother's side have suffered from stomach and colon CFCs and died before the age of 60. How can my sisters and I prevent this situation? Okay, so, well, first of all, don't eat what they ate. Um, when we grow up in a family, what we learn is not only learn what to eat, but we learn how to live, even if it's not directly. Families have different ways of expressing emotion. Some families are screaming at each other. Some families are repressing it. It's not allowed to show emotions, and so either way can be toxic to us. So we really don't. We have to understand. So that's what we're inheriting. There's no genes, because I think the question in here, the implicit question in here is, well, if they got it, then I'm going to get it. But there's no genetic. The stomach and the colon are not, they're completely different. They're both in the gastrointestinal system, but anyway. So what you need to do is live a really healthy life, really healthy. Go to bed early. Move around all day long. If you're working at the sedentary job, you get up every 60 minutes and give a good 5-10 minutes of heavy exertion. Okay, do that. Eat only human food. Don't eat for 18 hours a day. There's many, many different things you can do. I have on my drlodi.com, there's a Stop Making Cancer a video series. You can get that, and it'll teach you how to make food. It'll teach you how to meditate, different things. So, and movement, a lot of things like that. Plus, I give several lectures on there, so you can do that. But just live really healthy, eat really healthy, and you don't have to worry about it. And if you have any deep, like, secrets you're keeping inside of you from that you're if you're not telling the truth to a spouse or to a friend or to somebody close, you need to change that, because that'll hurt you inside. Okay, so now my mom was diagnosed with a rare, incurable, and aggressive cholangiocarcinoma. That means in the bile ducts, right? The bile ducts, which are part of the liver. They told her their only option was chemo until palliative and wasn't a candidate for surgery. Her most recent MRI showed growth and mild to moderate ascites. Can you get rid of ascites naturally? We're trying to prevent going to the hospital if we don't have to. Also, any recommendations of this type? Fenben, ivermectin, fasting. Yeah, all of that. All of that. And most of all, praziquantel. Praziquantel is important for the liver flukes, the little liver flukes that get into the gallbladder. Okay. Oh, Pistorchis verini is the little. Well, it's one of them. There are actually a few of them. Clinorchus as well. The little flukes that it can get in there. So, Kelly, I'm not sure where you folks live, where your mom has been, but that's usually the case with cholangiocarcinoma. It's not rare, it's not incurable, and it's no more aggressive than, you know, breast or liver or colon. I mean, it's not all these words they're using to scare you to get to do chemo until you're palliative. What that means is you're going to think I'm palliative because I have this cholangiocarcinoma, but you're going to be palliative because you're doing high dose chemo. High dose chemo would make anybody palliative. In other words, where there's nothing else you can do but care for them and make sure they're comfortable. Chemo is a heavy duty poison, and you know so they're not telling you the truth. Now, if you have ascites now, that means that there's some blockage in the pulmonary vein that goes back to the liver is kind of being blocked. And I don't know if it's lymph nodes. I don't know your situation. So when you're asking me, how do we take care of ascites? One thing you do, your medical doctor should be putting you on furosemide, 40 milligrams a day, probably around that, once in the morning. And then aldactone, 25 milligrams 4 times a day. Now, what these are is they're diuretics, and taken together, you don't have to worry about potassium, but that should keep it from growing. Okay. In the meantime, we've got to get rid of it. Now, I hope you're not doing chemotherapy with them. So, anyway, Kelly, if you give me, you call an Oasis of Healing, and and we'll set up an appointment with me. And then someone over here is asking me, uterine. Is there any alternative treatment for uterine sarcoma? Okay, any sarcoma, again, please understand, everybody, these are not separate and distinct entities. Okay, the only difference between a sarcoma and a carcinoma is based on the embryological origin of those tissues. Sarcomas come from the middle part of the embryo, and carcinomas come from the outside part of the embryo. That's all it is. Okay, so sarcomas are either bone or muscle, cartilage, things like that, and carcinomas are, skin, the lining of the gut, glands, brains, to nerves, things like that. So that would include breast, colon, pancreas, and stuff like that, usually carcinoma. So the therapy is not different. You've got to change your way of life, and you've got to get rid of all the toxins, and you've got to stop listening to these people, because they're going to throw names around. They're going to scare you. That's what they do. It's called the standard of scare. They scare you so that you'll do what they're saying. So again, here's someone else with a liposarcoma. You're saying, I can't find much information about, this is from Deborah, soft tissue liposarcoma, and a cure looks bleak. Will juicing and enemas help treat soft tissue liposarcoma? The cells are dedifferentiated. One kidney has been removed and has a catheter because of obstruction. He is going to a well-known hospital in New York City, and they aren't doing anything but delaying giving him information. Any information or a recommendation to a facility like you would have been involved with in this area would be helpful. I can't thank you enough for all the information. Okay, Deborah. So you're in New York City. I honestly don't know. I don't know anymore any centers there. The closest I know to there is somebody in Clearwater, Florida. But I don't know any place that has food, teaches you how to eat, how to, that involves the whole thing, that teaches you, because, I don't know anyone who's doing that except for us. And that's not a sales gimmick. They just don't know anybody. And if anybody does know of any centers that are comprehensive, that do everything, please let me know so that I can spread the word, okay? Because I really, I want everyone to get well. I want everyone to get well. And I don't want you to get your money stolen from you like they do, okay? Yeah. Look tired? I am tired, yeah. It's been a long day. But anyway, I had a great time today. I love talking to people who are listening. That's ones I like listening to. What kind of doctor am I? You mean what was my training? Well, I went to medical school, graduated medical school, did my internship and residency in internal medicine, started an oncology fellowship, but I couldn't continue watching people be destroyed by what we were doing. So I left as an internal medicine specialist, and I practiced that for like 10 years, conventional, worked in ICUs, CCUs, emergency rooms, and things like that. And then went around the world, studied about all these alternative things and different ways of treating people, and came back and started in New York City, where I opened up my first center and blah, 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 blah. So here I am. That's what kind of doctor am I. The immunotherapy used for cancer seems promising, no? Well, not what the immunotherapy they're talking about is checkpoint inhibitors. I mean, that's what they do. And that's only one small aspect of chronically fermenting cells. So one thing we have to remember is that we have to understand the metabolic differences between chronically fermenting cells and healthy cells. We've got to find the metabolic differences and make sure, and then we work on those. You've got to work from a metabolic aspect. You can't work from like a poison, I'm going to kill it or cut it out, because that just doesn't work. Because if you haven't changed the underlying metabolism, it'll just come back. It'll just come back. So you've really got to work at it. That's why we do all the cleansing and all the things we do. We use repurposed medications and all that. It's very, very important. Okay? Yeah. By the way, fibrosarcomas, sarcomas, uterine sarcomas, osteosarcomas, okay, they're all sarcomas. The carcinomas are the carcinomas, but the basic fundamental biology is the same. The only difference between all of these is the tissue of origin, where it starts, okay? And that's what will give it its different characteristics, okay? Not that it's a different kind of CFC, because there's only fermenting cells. That's what they do. Are parasites involved? Yes. Can radiation cause it? Yes. Can high dose stress and eating a lot of glyphosate and poisons? Yes. I mean, yeah, a lot of things lead to this final metabolic adaptive process known as uh, um, the Warburg effect, or aerobic glycolysis. That's what it is. Okay, this is Barbara. My husband has had two intestine CFC blockages and scar tissue build up fast, and his food has trouble passing through and causes pain. Is there anything he can do to dissolve the scar tissue and the adhesions? Well, I'm not. Yeah. Okay. So there's different kinds of adhesions, right? So like the bowel, as it loops around like this, it could. I mean, if it gets, sometimes the bowel can fold on itself, and that's one thing that can be resolved. However, adhesions are scars that are on the outside of the tube, right? So if you have an adhesion, which is a scar, like it's almost like a cobweb, that's coming from incision on the up on the where the abdomen was, right? The abdominal wall, and it's down here and it's looping over the bowel. Unfortunately, there's no natural thing that does that. But if you have a good doctor, they can go in through the belly button and clean it up. And that's the problem. All those surgeries, because you don't want to make another abdominal incision and have more of a chance to get more adhesions down the road. But if you go through the belly button, and they can do a laparoscopic lysis of adhesions, they can do that sort of thing, and that way you're not really sick. You don't have to stay overnight in the hospital and all that. But there's nothing natural that you can do to get rid of scar material inside the body. Okay, so now let's look over here. Let's go over here. Okay. Okay, this is Instagram now. Curious of your opinion on using melatonin as a prevention and dosages for such. Well, everyone, I would take a minimum of 20 milligrams a night. It's very, very important. That's why our body makes it. It's why blind people have less CFCs than people that can see, because when you're in the dark, your body makes uh, melatonin. Okay, so at least 20, even more. Also, make sure you have you put on like an eye mask, or make sure your room is dark as well. That's very important. But that's melatonin. 3 important things. Number 1, it helps make you sleepy. Number 2, it cleans up a free radical called the hydroxyl radical. Okay. The hydroxyl radical is a biochemical intermediate that forms throughout the day. Every picosecond, every nanosecond, we're making hydroxyl radicals, and they're used sometimes for other processes, and sometimes they just accumulate. And so that's why we have melatonin is the night janitor. While we're sleeping, it goes around and cleans up all the hydroxyl, not all of them, but as many as it can. So the more melatonin you have, the better it's going to be. And you want to clean them up, because if you leave those in there, they will actually cause a lot of damage. Now, the third thing it does is that it enhances immunity. It increases T cell function, increases natural killer cell function, right? So it's just pretty incredible. It's very, very important. It's a powerful antioxidant. So as a preventative, I personally take about 120 milligrams a night. Okay. Some people report nightmares with melatonin. Any ideas why? Well, okay. One thing you can happen with melatonin is it can cause vivid dreams, and it's not. The thing is, you probably weren't aware of your dreams, or they weren't that just weren't memorable. But melatonin will make you dream. Now, if you've got some nightmares going on, I'm not sure what they are, but it could be there's unresolved things. The purpose for dreaming. When we sleep, we've got there's two things that are happening, two fundamental, a lot of things happening, but two fundamental things. Our body, our physical body, is being regenerated, being cleansed, and getting rid of all the old little organelles and things like just kind of cleaning out and renewing, getting renewed. The same thing with our mind. Now, our mind, throughout the day, you run into situations where you're frustrated, where you're angry, and whatever, and you can't express it, or you've got all that. You've got some dreams that you weren't able to meet. You weren't able to accomplish this, and so you're sad about that. You may still have some fear about, I don't know, getting locked up in a FEMA camp, or some fear of somebody running up to you and injecting you, or something. And who knows the kind of fears you could have nowadays. So any of that, all that stuff has to come out, because if it's sitting in there, it'll drive you crazy. So when we sleep and dream, that's why sleep cycles, we have 90-minute sleep cycles throughout the night, and the majority of the 90-minute, the majority of the 90-minute sleep cycle before about 1 a.m. or 2 a.m. is restorative sleep, renewing, and then a little bit of REM sleep, which is dream. And then after, it's more dream sleep and less restorative. Okay, so that's why it's like that. We have to clean out the mind. So dreams don't necessarily mean anything. It's just letting out stuff, right? So if you're letting out things that are making you afraid, that's good that they're getting out. As long as the nightmare doesn't, it's not like a night terror that really is a horrible, horrible situation where you're almost scared to death. That's not good. But maybe you weren't dreaming enough, and maybe the melatonin is going to help you get some of that stuff out. Because remember, it doesn't mean anything. You don't need to remember it. You don't need to try to figure out what it means, because it doesn't necessarily mean anything. Okay? Okay, so suggestions for treating cholangiocarcinoma, only given palliative chemo option. Oh, yeah, we talked a little bit before, Kelly. I told you, yeah. Praziquantel, all the other stuff. Let's jump on it. Let's take care of this. Don't worry. And let's, don't listen to them, Kelly. Don't listen to them. What are the key things you would do as a preventative for CFCs? This is from Kale. K. So, Kay, what I would do now? You mean what I do? Not that do what I do. What I do is go to bed early, except tonight. Eat. Don't eat for about 18 hours a day. Just eat within a 6-hour window. I try to even make it less. I try to eat within a 4-hour window. Stop eating 4 to 5 hours before sleep. Move around as much as possible. When I eat, I try to eat human food, which is plants, and fruits, nuts, seeds, plants. Make sure I get 60% fat, healthy fat from chia seed, hemp seed, flax seed, like that. And that's it. And I take a lot of supplements. I take vitamin C, I take vitamin D, I take vitamin A, I take iodoral or Lugol's, which is iodine. I take melatonin, and I take some senolytics. Yeah. What are your thoughts on lung CFCs with mets to the brain? Same thing, Rose. Same thing as all the other ones. Remember, please, this seems like it's a difficult thing for us to remember, but please keep in mind that we've been lied to. They're telling us that there's different types of CFCs, and there's rare and there's not rare, and no, it's the same thing, whether it occurs in my knee or my liver. What is the difference? My knee is not near anything else, but if it's a sarcoma, that means it's coming from, let's say it's coming from a bone, it'll act in a way that it'll have the pathways that a bone would in terms of drainage and stuff. So it'll be that. As a liver, it'll be doing something else. So the difference in all these different kinds of CFCs is not the fundamental biology, but to the location of starting it. Okay, so basically, when you say what are your thoughts on lung CFCs that got to the brain, it would be the same as breast CFCs that went to the brain, or thyroid that went to the brain. Anything. So please keep that in mind. Okay, and then I'll answer the question. Is if it's gone to the brain, you're going to have to, you're going to have somebody who can keep an eye on it by doing MRIs and things like that. You're going to have to be on, if it's in your brain also, you're going to have to be starting on boswellia, which is also known as frankincense, to reduce the cerebral edema, the brain edema. If not, the doctors will probably put you on dexamethasone, which you'd prefer not to be on, because it's a steroid. It's much better to be on the boswellia to prevent that. And and then the lung, you have to go to a full-on. You've got to go to a full-on integrative oncology center where you can get vitamin C, all the therapies that we do, intravenous curcumin, you name it. Plus the anti-parasitics, the dental is all the same. Please don't think that these are different issues because you had it in your breast, your ovary, your brain. It's all the same thing. That's very, very important. What have you seen as the role of EBV in CFC development? Epstein-Barr virus. Well, Epstein-Barr virus, if you're, in Africa or a place where there's malaria and you get bit by malaria mosquito, it kind of protects it. It blocks the immune system from specifically eliminating the Epstein-Barr virus, which then goes into the lymph nodes and produces what's called Burkitt's lymphoma. Also, it can. There's certain strains that are found in lots of Chinese people, and they get what are called nasal pharyngeal CFCs. Throat, tongue, things like that. Yeah, I mean, that's that. That's basically it in terms of CFCs with the EBV. What underlying toxins are most common between the CFC patients you've seen? Well, they've changed. Oh, no, I don't think EBV causes lupus. No. Lupus is what they call an autoimmune situation. That's just where you have the polarization is towards Th2, which is a certain aspect of the immune system. And I think all autoimmune conditions there's a microorganism that we're not identifying, and the immune system's trying to get it. So I would definitely look at parasites for autoimmune. Definitely, we've got to do that. So underlying toxins. Well, so they used to be. They're different now. They're different. Not different, but we're seeing more and more of pesticides, herbicides, right? Like we're seeing everyone has glyphosate now. It didn't used to be that way. Everyone's still got the heavy metals, the heavy metals. Are we seeing some change? Yeah, we're seeing more tungsten. We're seeing more uranium, things like that. More aluminum. What else? In terms of, we're seeing a lot of plastics in people, BPA and other plastic derivatives. So we're seeing a lot of those, right? So you want to use binders. You want to do some sort of chelation, whether it's intravenous EDTA or intravenous. Whoever you're working with should know. So if it's predominantly mercury, you want to use DMPS as an IV, oral DMSA. If it's lead and some of the other ones, you're going to use EDTA, and they're all going to get everything, but they get them at different rates, different variables. Right. And the binders are going to help bind up, like the uh, fulvic and humic acids. Cellcore puts out a really nice binder. Yeah. All right. So here's a question. Why would my vitamin C and CoQ10 levels be undetectable in my labs and I do high dose IVC? Yeah, really good question. I would question the lab first and or the people that drew it and prepared it. Um, if you had undetectable vitamin C, you would have probably you'd be very sick. You'd have scurvy. And if you had undetectable CoQ10, again, same thing. So I don't believe it. And if you're doing the high dose vitamin C IV, even if you're not drinking it daily, if you're getting it once or twice a week, that should at least give you enough to keep you above the normal. Because remember, the normal average person is not eating vegetables and plants. The normal average person, and they still have there was a study in the in England where they looked at, was it Germany? I'm sorry. They found that 40% of the German population had less than 7. They had low, or what they call scorbutic, almost on the verge of having scurvy. But you're not that way because you're getting IVC and CoQ10. I don't know. Are you taking, are you taking any medications? So here is Lisa. I'm 60. Should I be using natural progesterone like yam cream to balance? Yeah, but not only that, you should, yeah. What I would do is you could do that. A lot of indigenous cultures do that. When women get older, they start taking these things because that's what people do in their culture, and they don't go to a doctor and get blood tests. But since you're in this culture, you could actually do that. You could go and find out what your levels are, and then take them. What time is it? Oh my gosh. Um, but because you might not only need progesterone. What you want to do is listen, when it comes to biologically identical hormones, what you want to do is you want to bring your body back to around the age of 40. It's a good age. 40 to 45, 38, 45, whatever, around there. Okay. So your hormones aren't wild and crazy like 20s, and they're not starting to decline like 50s too much. So you're right in the middle there. And that's where you want to get to. All right. So that because you don't, even though there are some obvious consequences of menopause or andropause, like, a woman, her menstrual cycle stops, libido goes down, she experiences vaginal dryness. But things that you're not aware of is that you're getting more osteoporosis. You might have trouble remembering and thinking. You're going to have cognitive decline. There's things that you're not even aware of. You're going to have a higher risk of coronary artery problems and stuff like that. So you want to keep your hormones balanced. The same with the man. The man is going to get osteoporosis, not to the same degree, but also senility, also depression, also erectile dysfunction, also loss of libido, which are the things that we usually think about it. But there's a lot more metabolic consequences than we usually think of with these, with the loss of the hormone function. Okay, and best way to clear up SIBO, right? As you know, that means there's an overgrowth in the small bowel of. Basically, it's a severe dysbiosis. What do you got to do? I would first of all do a juice cleanse. I don't know what your weight is, but I would definitely do a juice cleanse, clean it out, do some colon hydrotherapy, get rid of any toxins in your mouth or anywhere like that. You've got to pull the plug on all that stuff. But in addition, start taking lots of probiotics orally, and then you can do some rectally as well just before sleep. Yeah, all of that's very, very important. Okay, now, yeah, so you've got to restore the healthy bacteria. You got to restore them, and remember, they need something to eat. So if you want them to keep them, you were told you have no hormones. Okay. If you really want to keep you're putting in probiotics. If you really want to keep them, what you need to be doing is um, eating the food that will feed them. So eating plant food. So if you're eating healthy food, what's going to happen? When you take the probiotics, they're going to stay there. They're going to have something to eat. So, for example, someone on a fast food diet, the bacteria and the microorganisms that will stay in there are not the kinds of microorganisms that will support our health. They're the kind of microorganisms that will not protect our immune system. It will not protect our, all the different things that the immune system do. The crosstalk between the brain and the gut, right? Through these different microorganisms. But if you're eating a lot of plant foods and 80% of it is uncooked, you're going to have a really healthy microbiome. But it's going to take a while. There'll be a period of time where it'll take a while. You got to put them in there, and then you got to eat right. That's what you got to do. Okay? How should I support my liver when I take parasite supplements? As I said, 3 weeks on, 1 week off. But every day you can be taking silymarin or milk thistle. You can be taking alpha lipoic acid and B complex. Take 400 milligrams of alpha lipoic acid 3 times a day. Take silymarin 3 times a day, and take a B complex 1 time a day. The other thing is, if you have, those there are really good support. The other one you can do is you can take low dose naltrexone, 4.5 milligrams at night. Yeah. Should a woman truly take the advice to have breast surgery for CFC breast tumor? No. I mean, no. No. I mean, first of all, if that would take care of the problem and it would be done, that might be something to consider. You understand? But we don't know. Most of the time, it's not. I mean, 99.999999999% of the time, it doesn't work. All it does is, make you lose a very important aspect of your body image, right? It's very, very important. Okay. And it causes them to spread, and they're still going to want to do chemo and radiation. That's what they're going to do. So that's not it. What you got to do is let it regress from inside out. Okay. But there's a lot of things you have to do. You can't just not do the surgery. You've got to do a lot of things to change your life. So your name is Darling. Yeah. So let's talk. I mean, I've been mentioning it. If you keep listening to us, and but I would like to help you if I can. Do you eat low carb diet if you had if you were concerned about breast and endometrial CFCs? 202 in 2022. Well, I'd eat low cooked carbs, like no potatoes, low rice, potatoes, bread, pasta, cooked carbs. but there's carbohydrates in spinach, raw spinach. There's carbohydrates in so. But I know what you're talking about. You're talking about the cooked carbs, and yeah, the cooked carbs. I mean, if you're clean, you don't have any of that in there, and you want to eat them, um, a couple times a week. Eat a little bit of maybe some brown rice or quinoa is less carbs. Um, you can have a sweet potato here and there, but try not to have cooked carbs. But you can, but you have to remember you're going to get all the carbohydrate requirements from spinach. All plants, all plants have carbs. All plants have amino acids. All plants have uh, chelated minerals and phytonutrients. And plants are amazing. Change your diet. Listen. Instead of what we have a tendency to do, we have a tendency to try to find ways to try to eat healthy, but to continue to eat some of the stuff that we like. But here's another idea. Try to do this. Try to find food that satisfies your taste, your appetite, but is healthy. You have to explore. You have to go get lessons, and you have to do that, and make it a challenge. Make it fun, because you wouldn't believe it. There are foods that you would say, this is raw. Wow, that's fantastic. That's delicious. So how can I make it delicious? So don't think of if and that, okay. And then will I still want to go back and have my comfort food once in a while? Sure. But for the most part, if you can modify your appetite so that you start to enjoy and you're like, great, I got to have a kale salad. That's fantastic. Imagine that. Or soaked nuts and, whatever it is that I like pumpkin seed butter. I mean, Omega Nutrition out of Canada. Whoa. They have a raw pumpkin seed butter that is crazy delicious. Yeah. If anybody out there ever liked peanut butter, this is it. You'll totally love it. And you can put it on dehydrated crackers. You can put it on an apple. You can put it on carrot. It's really, really delicious. And it's so good that, if you're just hungry, just take a big tablespoon of it and eat it. That'll fill you up for a while. So we have to change our appetites. We have to change our ways of thinking, right? Instead of trying to bring it in. Now, I'm not saying you don't have it. If you have, you got to, it doesn't mean you still couldn't have like a baked potato, sweet potato or something like that. But if you actually have active CFCs, then what you want to do is try to be 100% uncooked for a year, 9 months to 18 months, whatever it is, and love it, enjoy it. Don't do it as something I gotta do it as something I get to do. I get to do this instead of getting chemo. I get to do this instead of having my body mutilated. I get to do this instead of losing my hair and feeling sick and vomiting. I get to do this. Yay. Okay, that's what I get to do, right? What do I get to do? What is how cool is that? And how uncool is going into the hospital? No comparison. So let's look at it that way. All right. Remember, the life we grew up in, this unnatural world. We live in a world that is so insane that I really myself I don't like anything about the modern world. Nothing. I would love to go back 2,000 years, 3,000 years. I don't like this. There's nothing convenient about it. There's nothing real about it. People are not authentic because they grow up in an artificial world. They can't be authentic. We have to lie all the time. You can't tell your boss what you think. You can't. It's just it's a crazy world. And look, remember we talked about before. What if we had our no clothes on and we were in the jungle? We don't even know what to eat. We don't know how to take care of ourselves. We don't know about anything about the planet we live on. Most of what we know on the planet we live on is pictures we've seen and books we've read. We don't know, and we're not familiar with nature, which is ridiculous. But anyway, but because we live these ways, we've got these artificial habits, artificial tastes, and all that. I got to have a pizza. I got to have a kebab or whatever it is. Instead of real food, craving real food. Can you imagine that? Yeah. Anyway. All right, you guys, listen, I have to get up really early tomorrow. because I'm flying back. So, but next time I'll be longer. We'll keep it at 2 hours. But this I got to just get up early. So anyway, thank you so much, Sawadee Kap, Kapuma, and Namaste, Namaskar. Aloha to you all. Have a wonderful week, and all you guys that came to visit today. That was amazing. Thank you very much. It was wonderful to meet you all. And see you next week. Okay. Bye bye.